Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And we are here at the Chicago Midwinter with the phenomenal Deb Carrier. Thanks for being here.
Thank you for having me.
Yeah, I'm excited. You've done a lot of innovative things in dentistry, and one of the big things that you do is CPR Sisters, right? And we were wanting to talk about, because in a prior version of things that I did, we worked a lot on regulatory compliance for offices. And a big piece for offices that's a friction point is CPR training.
Exactly.
Right. So can you talk a little bit about how you've innovated in the CPR training space?
Yeah, so we have this amazing new way of teaching. Then the format is what we're learning is people are learning better this way. So in a traditional class, you all know, you stay after work, everybody stays, everybody throws the mannequins on the floor, you're there for 3 or 4 hours. And that's how I have been teaching for over 20 years. But during COVID, the guidelines were changed and we were able to start teaching it virtually. So we weren't even really sure if this method was going to work or not, but it is fantastic because you actually end up getting more one-on-one time with your instructor and more hands-on practice with the equipment than you do in a traditional class. So it is done, the instructional part is done virtually, and then you have to go to the American Heart Association and take a tutorial, which takes the place of the written test that you do when you're in person. And then we ship the equipment to your home or office along with the video. You practice along with that, and then you feel extremely confident when you're taking your skills assessment.
I hadn't even, as we've talked about your CPR training, I didn't even think about that piece where instead of being rushed as quick as possible, you're out rotating through with the mannequin, trying to figure out, like, how do I get competent enough to not look like an idiot in front of the instructor. You can take your time, digest the material, and then do it virtually with somebody. That's really, that's not an inconsequential.
No, and that was really a part that we didn't even think about when we started doing this. We thought we were just going to be able to reach people that can't find a class or live out remotely where it's hard for them to find a class and then have to drive to it. And then also these offices have to close down for a half a day sometimes to get everybody trained and cancel patients. And there's that part of it too. But then we learned very quickly with the testimonials we got that people were saying, I've been taking CPR for 20 years and I have never felt this confident with our skills. And we know for a fact, we've heard from some of our students who have saved lives. So we know at the end of the day, that's what it's all about.
Yeah, at my practices, I'm trying to say how I could say this nicely. So we would do CPR training every year.
Yep.
Even though it's mandated every 2 years because of this. I wanted to feel more confident, and I have our team feel more confident doing it. So we're doing it twice as often as required.
Which is wonderful.
And then also you get like a new employee, and it takes that, and then everybody's on. It's hard to be out of cadence if you're doing it every year. But one of the barriers that we ran into is you have limited access to trainers. Right? There's a trainer nearby, or maybe two, and I'm in a large metro area, but still it's like that trainer comes in. Let's say that trainer you don't connect with, right? You're stuck for 4 hours with this trainer that you don't connect with.
Yes.
And then when they leave, finding another trainer for the next year is a challenge.
Very right. There were few and far between, and unfortunately, there's not a lot of really good instructors.
Yeah, but if it's virtual, it's more condensed, and then you can say, hey, CPR Sisters. Didn't resonate with that trainer. Could you have one of your other scores and scores of trainers next time hop on the call for however long? Wow.
And then there's another piece to this too, is everybody gets nervous. And when you're doing it virtually like this, like I said, you can practice for a week if you want to before you do it. And we still have people get on the live skills test part of it nervous, but then they calm down because it's just you and me. It's not the whole office watching what you're doing.
So really, yes. I think that as a dentist who has a healthy ego and is fine looking stupid in front of other people many times, I get a little bit of anxiety, right?
Everybody does.
And so I can't even imagine the person that's in a hygienist that doesn't, that's shy in front of other people and actually cares what other people think,
Right, exactly.
right?
Yes. Most people.
But they can't say anything because it's mandated training.
Exactly.
Wow, that's a really big point. So so this started off during COVID, like a lot of things have shifted.
Correct.
How have you seen this change how people are absorbing CPR training?
Oh, it's night and day. Absolutely night and day. Just the testimonials that we get are phenomenal about, how they're learning better, how they are able to do it on their time. So it just makes the whole process more relaxed, easier to follow, and like you said, they can absorb it better. And so at the end of the day, we're saving lives.
That's a noble pursuit to have. Wow. Yeah. So I would urge anybody who, look, it's something that we have to do. We might as well have it be better, more complete, easier to do, and just coordinating, doing CPR training can be a massive PIA for a single dental practice,
Exactly.
let alone across an organization of multiple dental practices.
Exactly.
Right.
Mm-hmm. And we have 3 different models. You can take it as an individual, you can take it as an office, and we ship everything to the office. Or if you have a big corporation, we take everything off the corporation's hands. So they tell us when their people are due, and we take it from there. We keep up with them, we remind them, we sign them up for the class, ship them their card, and so it's all taken away from them. And we keep them compliant.
Well, that's great. Where can people go to sign up to make their CPR training easier and better?
You can reach us at CPRsisterstraining.com. There's a form on there you can fill out. We will contact you, answer all your questions, and get everything set up.
Oh, great. So I would recommend everybody go to CPRsisterstraining.com, sign yourself up, and thank you so much. I think this is one of those pain points that just has not been innovated on in the space for a very long time. So Deb, thanks for what you're doing.
Thank you.
Yeah, thanks for being on the podcast.
Thank you.